Good morning. My name is Dr. ALYSSA DWECK. I'm a gynecologist here in New York, and I'm here today to speak to you about your menstrual period, first thing in the morning. So, first, I think it's really important that we get out of the way that your menstrual period doesn't have to be a taboo, horrible, dreadful time of the month, every month, for a period of 30 to 40 years. I think young women who are first getting their periods really need to think about it as a sign of general health and well-being, almost like a vital sign. The period is not taboo. It's a sign of femininity. It's a sign of fertility. It's a sign of reproductive health. And in fact, your period sometimes can really be helpful in order to help you to discern whether there are any medical problems going on that sometimes can show up with their first symptom being a change in your period. So let's first talk about what's normal and what's not. First of all, the average age of getting your period, which is called menarche, has actually not changed very much over the past 30 years. In fact, in the United States, the average age of menarche, or the first period that you see, is between 12 and 13 years old, 12.43 years to be exact. This usually occurs about 2 or 3 years after your breasts start to develop. So that's a general milestone and time frame for you. In general, the age of your first menstrual period may be a little bit higher in less developed countries, and nobody really knows why that's the case. It may have something to do with environmental factors, genetic factors, nutritional factors, and the like. In addition, it seems that those who have a higher BMI or who are overweight in childhood also seem to have a slightly different age of their first period, where the age is lower. Again, nobody really knows the reason for that, but likely due to some of the same factors we just spoke about. In the United States, 98% of young women will have their period by age 15, and it's generally considered reasonable that if the period doesn't come on by the age of 16, this is something that should be looked into. And that's when you would really see your gynecologist or your pediatrician, if the case would be that. In general, let's talk about what's normal in terms of your menstrual cycle. First of all, the amount of time from day 1 of your period until day 1 of your next period is considered the length of your menstrual cycle. The usual length is anywhere from 21 to about 45 days. This certainly can vary a little bit when you first get your period, where your periods may be a little bit more irregular, but as time goes along and shortly thereafter, they usually regulate and you can figure out what your cycle is going to be like. In addition, the length of your flow is typically about a week, but it may vary a little bit depending on genetic factors and depending on your lifestyle. There are definitely some known causes of menstrual abnormalities. So first, for people who are not getting their periods or who may be getting bleeding in between their periods after they've been regular for a while, there are certain things we need to look into. For sure, if you're missing your period, the first thing that we think about is pregnancy. So that's the first thing that needs to be ruled out. In addition, there can be some hormonal causes that can change your period nature. For example, thyroid abnormality, adrenal gland abnormalities. These are both glands in your body that secrete hormone. In addition, stress, believe it or not, can really alter your flow. We often see young women who are going off to college or to go off to live away from home for a while, losing their periods as a result of the change in their stress level. A frequent and sad thing that I see in my office not too uncommonly is women with eating disorders who will end up losing their period as a result of insufficient caloric intake and rapid weight loss. So this can impair your period. Finally, certain medications and excessive exercise can alter your flow. So these are all things that we look into when you come in with missing periods. A hormonal imbalance that we're seeing more and more of these days is something called polycystic ovary syndrome. This is a hormonal imbalance where ovulation is not occurring regularly. In other words, an egg is not being released from your ovary each month as we expect once you get your period. And therefore, hormones get imbalanced and people may miss their period, and they may have other signs of hormone imbalance, such as excessive hair growth, such as acne, and such as difficulty with maintaining or losing weight. So these are all things to keep in mind and things that your healthcare provider may look into if your periods are very erratic. Women also ask about what is the situation when their period is too heavy or too lengthy, and we will frequently find hormonal imbalances as a cause of this, but also bleeding disorders. So we'll look into that as well. Pregnancy also needs to be ruled out when your period is very heavy or comes at an unusual time. Finally, people complain of two other significant symptoms during their periods all the time to me in my office. The first is pain. Cramps are not uncommon, and they tend to run in families or be more common for certain people for unknown reason. There is a syndrome called endometriosis, which is unknown in terms of its cause, but the situation with this is that tissue that typically responds to hormone each month in the uterus grows outside the uterus in other areas of the pelvis, and it bleeds each month when you get your period, and it can cause pain and scarring and difficulty with pregnancy in the future. In addition, pain can be caused for other reason that's unknown, but ways that we treat pain would include medication, including a birth control pill, heating pad, pain medications, either over the counter or narcotic, and exercise, believe it or not, is quite helpful for this. Finally, a frequent complaint is premenstrual syndrome, or PMS. And this is the gamut of symptoms that bother people usually a couple of days before their period comes on. This would include weight change, water retention, mood changes, food cravings, a whole gamut of symptoms that are uncomfortable. And in its most severe form, which is called premenstrual dysphoric disorder, or PMDD, it really can be debilitating for a lot of women. We typically treat this with either lifestyle changes, diet, exercise, sometimes the birth control pill, or other medications that work in the brain in order to help calm these symptoms down. So I hope you will get active and interactive with asking questions. I have plenty that I will address that have already come into me so that we can talk about your periods and dispel some of the myths and take away some of the taboo that goes along with periods these days, because menstruation is not a disease. It's actually a perfectly normal, healthy state, and actually should be embraced as a sign of femininity and fertility. Thank you. Okay, so I'm going to address some of the questions that I've gotten already. Somebody writes in, does it hurt to use a tampon? And the short answer to that is it should not hurt to use a tampon, but the first time or two that you attempt insertion, it might be a little uncomfortable. So here are some helpful hints. First, make sure you're relaxed and in a private place. There's nothing more disconcerting than trying to do something that might be a little uncomfortable when you think somebody may walk in on the bathroom door or interrupt you. Get into a comfortable position. Some young women like to put one foot up on, say, a bathtub or whatnot so that their legs are somewhat apart. Some women will actually sit on the toilet in order to insert a tampon, and this should be helpful. In addition, use the smallest tampon that is reasonable for your absorption. This will allow for easier insertion. For first-time users, I typically recommend a really slim, slender tampon. And if you even need to put a little lubricant on it in order to facilitate insertion, that would be fine. Something like KY jelly or whatnot. If you feel like you trust an adult in your home, or you have an older sister or friend who's been through their menstrual cycle, it's perfectly fine to enlist their advice and help. Okay? Another question that was written in was, can you use a tampon if you're a virgin? And this goes back to my explanation in the prior question, which is it's absolutely fine. It would be highly unlikely for you to break your hymen, which is the small skin flap that usually breaks during first episodes of sexual intercourse, but many times will break before that for other reasons. And a tampon is likely not going to interfere with your hymen at all. So yes, the answer is yes. Again, use the smallest, slimmest tampon that you can find. Usually a slender junior would be your best bet for first inserters. Another question that came in is what to do if you've missed 3 months of your period, but you're not pregnant. And you know, this goes back to some of the explanation I was giving before regarding missed periods. Typically, we check for pregnancy even in people who tell us that they're not sexually active. It's just the right thing to do. Or at least if somebody's not reporting sexual activity, but you suspect that perhaps it's going on and somebody does not want to admit to that. So after you rule out pregnancy, we typically do an examination just to make sure there's no blockage of blood coming out from the vagina. But that's not urgent. And sometimes this can also be checked for with an ultrasound in order to make sure blood isn't backing up inside the uterus. Typically, we also do some other hormonal testing to see whether your hormones are imbalanced or check to see if perhaps you may have an irregularity with your thyroid gland or another gland in your brain called your pituitary gland. So checking for these hormones, if they are abnormal, we can treat those abnormalities, and then frequently we'll see the resumption of normal menses. More and more these days, we're seeing this issue called polycystic ovaries, which is an imbalance of estrogen and testosterone and progesterone due to lack of ovulation. And we can typically diagnose this by doing an ultrasound of the pelvis, which is not a painful test, and some blood work. And also doing a physical exam to look for some of the signs of hormonal imbalance, like hair growth on the face, like a dark velvety rash under the arms, like difficulty losing weight or maintaining weight. These things all tend to lean towards a diagnosis of potential polycystic ovaries. And what do we do to treat this? Typically give you a medication to bring on your period, and then consider something like the birth control pill in an effort to keep you regular and prevent pregnancy. Sometimes we often use a medication to basically regulate your metabolism, insulin, and glucose. This is called metformin, and we find that this is helpful in the prevention of diabetes for women who have polycystic ovaries and might be at higher risk for such. Another question that comes in that's really becoming much more common is this. I've heard that people are suppressing their periods with birth control for months or years at a time. Is this healthy? So the short answer is yes, this can be healthy if it's done in the proper way, and we'll talk about that momentarily. But who it is most helpful for in my practice seems to be women who are in the military, who really can't afford to have a heavy, painful, crampy period. Access to hygiene and feminine supplies may be limited when they're out in the field. So I find military women appreciate this type of suppression of their periods. Professional athletes who really can't afford to have their period during a major event also really do well with this type of method of regulation of their cycles. And certain women, for religious or cultural reasons, really don't want to have their periods, and therefore using methods for suppression is very helpful. So how do we do this safely? Typically, we use the birth control pill, which has been around for a very long time. And instead of giving it in a way where you get your period every single month at the end of each pack, we double up or triple up and save the placebo fake pills for, say, every 12 weeks. And pills are actually packaged this way in certain brands. What this allows is a safe way to get your period every 3 months without having to worry about bleeding in between, and it also provides good birth control. There are some pills that also can be taken every day continuously without any break at all. And in this way, women never get their period. We always take a chance of having some breakthrough bleeding, which means spotting in between the periods when doing these types of methods, but that typically resolves after a couple of months or 6 months of using the pill in this way. And women find this very satisfying, especially when they meet the criteria for someone who doesn't want to get their period at all. The other way to diminish the flow is certain hormonal IUDs. These are little teeny devices that are placed in the uterus in an office visit by your healthcare provider that are excellent for birth control, but also tend in certain instances lessen the menstrual flow, even to the point of not getting your period at all. A third way to suppress your menstruation is to use an injection called Depo-Provera, which is a progesterone shot, or sometimes called the shot. And this is used for birth control, but typically after a couple of months of use, we'll see people not getting their period at all. And for some, this is a welcome change, and for others, it can cause a little bit of distress, but with good reassurance, this is perfectly safe, and some women enjoy not getting their periods at all. So that's a very long answer to a short question, but important. Another question that comes in is about toxic shock syndrome, which thankfully we're seeing a lot less of these days. But toxic shock syndrome is an infection that is caused by a bacterial toxin, and in past years has been linked to the use of very high absorbency tampons or leaving them in for too long. I don't know why some people might have been prone to this in past and others not, but this is a scary disease that can cause rash, very high fever, shutdown of some of your crucial organs, and hospitalization, and in rare cases, death. So we typically advise that people keep tampons in for definitively no more than 8 hours ever, especially in the overnight hours, and to report any symptoms that I mentioned above, particularly a beet red rash and a high fever, if to your physician right away, if it's related to your period. Another question comes in about complications from the menstrual cup, similar to tampons. And I think, again, unless you have a sensitivity to the material of a menstrual cup, and I guess I should back up and say that a menstrual cup is a small device. There are multiple companies that make these. It's typically made of maybe latex or silicone, and it's literally a little cup that you place in the vagina during the time of your period to catch your flow. And this is really helpful for women who don't want to use tampons or pads, or for women who feel really environmentally friendly and don't want to have that waste to get rid of each month. And women like to use these cups from time to time. So as far as complication, really none other than the fact that they might be a little tedious to get in when you're first initiating them, or if you have the sensitivity to the material. But overall, they're very well received. Another question that comes in is, I have clots in my pad. Is that normal? So I think women tend to get accustomed to what their periods are like month to month and year to year. So if you're somebody who gets small dime size or pea-sized clots during the heavier day of your period, that's typically okay. However, if you're getting really large clots, or clots that seem unusual for you, or pain suddenly gets worse with your flow, or your flow gets so much heavier than what you're typically accustomed to, you definitely need to touch base with your healthcare provider, because it could be a sign of something else going awry. So that would be my general advice. Keep in mind, when you're, for example, laying down all night to sleep, and the blood from your period may pool inside the vagina, and then you get up in the morning, and upon getting up and perhaps going to the bathroom, you see some clots come out. That may just be from blood pooling overnight and clotting and then coming out. So you can monitor that symptom throughout the day. Okay? Another question that I'm getting is, I started a new birth control and now I have my period for 4 weeks. Is that normal? So sometimes it takes your body a little bit of time to get used to being on a birth control pill, for example, and you may get some irregular bleeding during the pills where you shouldn't be getting your period. The first month or two that this goes on, that's not that unusual. But if it's persistent for more than 1 or 2 cycles, I would absolutely touch base with your healthcare provider, because it may be reasonable to change your brand of pill or your form of birth control altogether. And I should always make note that we do check for pregnancy if you're on the pill and you're spotting, because every so often the birth control pill can have a failure, although it's unlikely, and bleeding can be the first sign that you might be pregnant. So this is something to keep in mind. Another question I'm getting is, can you get pregnant during your period? And the answer is, if you're getting your period and you've definitively ovulated beforehand, it may not really be your period that you're getting, and so you could get pregnant during a time of bleeding. So any abnormal bleeding deserves to be checked into with testing, including a pregnancy test. However, plenty of people practice fertility awareness when it comes to birth control. And what this means is that you get accustomed to when you're ovulating during your cycle, which is typically in the middle of your cycle, and then you get accustomed to getting your period about 14 days later. If this is your usual pattern, then you can safely have sex during your period unprotected, because you know when you're ovulating and you can time your sexual activity based on that, whether that's in an effort to get pregnant or in an effort to avoid pregnancy. So the short answer to your question is no, you should not be able to get pregnant during your period. But the longer answer is that you really need to know your cycle to know that the bleeding you're getting is not related to something other than your period. Okay? I love this question because I get this all the time in my office. The question is, what are some discreet ways to manage period pain at school? So this is something that shouldn't have to be an issue. And I really encourage young women to come in and see their healthcare provider so they can manage this issue. But here are a couple of pearls. First, there is something to be said about a heating pad. This is a simple, old-time remedy that stands the test of time. I would pick up a heating pad that sticks to your abdomen called Thermacare, and I'm sure there are other generic brands of this. They are not visible to the outside world, so they stick on your belly so they can help to control pain for even up to 10 or 12 hours, and they're hidden under your clothes so nobody will see that. So that helps. And the way that helps is it brings more blood supply to the uterus and helps to relax that muscle a little bit. In addition, try to anticipate when you're going to get your pain. So if your pain and your period come on a particular day each month, put a reminder in your phone that the night before you might want to take some non-steroidal medication like Advil or Motrin or Midol or any of the over-the-counter preparations that might help. But getting ahead of the pain before it starts can be particularly helpful. And keep these medications in your bag, in your backpack at school, and hopefully in between classes or during lunch break, you can replenish your dose if necessary and if it's time. A third option that your healthcare provider can certainly provide for you would be birth control pills if you're a candidate for them, because that's very helpful with cramps, and a lot of women turn to that, especially when the nature and cause of their cramps is endometriosis, as we spoke about before. Finally, I think exercise doesn't get enough attention when it comes to cramps. So regular exercise and beefing it up a little bit right before your period can really be helpful in an effort to get rid of some of your cramps. What are some other discreet ways to manage your period at school? I think we pretty much went through that, but always carry an adequate amount of supplies in your backpack. Some of them are small and people don't need to necessarily know what they are. You could keep them in a cute little case or whatnot, and that will be helpful. As far as other questions, is it okay to have sex during your period? So I get this question all the time, and the short answer is it's definitely okay. You do need to prepare a little bit for a little bit of a messy situation from time to time, but putting a dark towel on the sheets beforehand might be helpful to protect your sheets. I would say warning your partner, especially if you have a male partner who might not be accustomed to what a menstrual flow would look like. That's important. Some women turn to using a Diva cup or a diaphragm in order to catch some menstrual flow so that they can have sex comfortably without too much blood being visible, and that's okay. But keep in mind, blood can sometimes act as a lubricant. So some women enjoy that. In addition, some women feel heightened sexuality during the time of their period, partially because they just do hormonally, but partially because they're not afraid of getting pregnant. So this may heighten the sexual experience. So the answer is sure, you can have sex during your period. As far as other questions coming in, I'm sorry for the interruption. How soon after childbirth does the period return? That's a great question, and it's really different for most women who are nursing, who typically will not see the return of their period right away. So a lot of women with breastfeeding will not get their period for up to 6, 7, even 8 months, and that's perfectly fine. But keep in mind, those women do need to use some sort of contraception in order to prevent pregnancy, because it is possible to get pregnant at that time. The period for women who are not nursing typically will return anywhere from 6 to 12 weeks, and that's reasonable. If when you go in to see your healthcare provider for a postpartum visit at 6 or 8 weeks, they'll usually elicit this information and make sure that there's no problem to be concerned about. I get a question about being very fatigued during your period, and is this a symptom? So fatigue is not an uncommon symptom for a couple of reasons. First, it is a common PMS symptom or premenstrual symptom, and some women even can tell that that's why when their period is going to come on is when their overwhelming fatigue starts. So again, increasing exercise before your period can be helpful and preventative. Watching the diet, even though you have the urge to eat every chip and salty and sweet thing you see in front of you, but watching your diet so that you hydrate well and eat plenty of healthful foods might be helpful to prevent fatigue. But in addition, some women bleed heavily enough that they become anemic or get a low blood count, low iron during their periods. And as this goes on month after month, it's something that can take a toll and cause fatigue. So if you feel that it's continuous, definitely get a blood count checked, or maybe just add some extra iron to your diet or as a supplement, and that could be very helpful. Lastly, fatigue can sometimes be a sign of pregnancy, so keep that in mind as well. I get a question from somebody who says, I've read online that women are eating special endo diets to manage their endometriosis and cysts. Could that have any impact? You know, I'm not really familiar with what the quote-unquote endo diet is, but I would venture to guess that a healthful diet in the typical Mediterranean fashion is probably best. This includes high fiber with fruits and vegetables that are fresh, low fat, lean, lower fat, but good fats, and lean proteins. And these things are really helpful just for general overall health, which in general will help your menstrual health. Regarding what foods are good to eat before and during your periods in general, but not specifically for endometriosis, I find that caffeine, while some people really crave this before their periods because of fatigue and just feeling a little bit down and PMS-like, caffeine can also increase the feeling of anxiety and jitteriness, and that's a natural side effect of caffeine. So if this is a typical PMS symptom for you, then avoidance of caffeine might be helpful. In addition, lots of women will complain of water retention premenstrually or during their period. So watching your salt intake, which can increase water retention, might be helpful as well. But I'm a big proponent of a Mediterranean diet and exercise to really help with symptoms. So I hope that helps. I get a question, can you swim when you have your period? And the answer is, unless you're in shark-infested waters, you should be just fine to swim with your period. I would recommend that if you're using tampons, to change it when you come out of the water, because it may become water soaked, and that would be helpful, but there shouldn't be any trouble with swimming. Why does PMS want me to make me eat 5 pints of Ben & Jerry's? I think if I had the answer to this question, I would maybe win a prize. But I would say that there are chemicals that change in the brain, most likely due to hormone changes and other hormonal and neurotransmitter changes. These are chemicals in the brain, likely alter our appetites and cravings for things right before the period. But I think that's unexplained at this time. Another question I'm getting, which I'm glad I'm getting, is how heavy is too heavy? So, excuse me, your period can really be a sign of healthfulness. And if your period is basically soaking, say, 2 or 3 super pads or tampons per hour, this is way too heavy and should be brought to the attention of your clinician. We actually have found, especially for women getting their first periods that are very heavy and very long, that they may actually have a bleeding disorder called von Willebrand's disease, or hemophilia, if you've heard of that, and we'll often pick that up with a very heavy first period. So definitely monitor what's normal for you and bring to your healthcare provider's attention if you feel the period is heavy, specifically more than 2 tampons or pads per hour for sure. I'm getting a question about depression during your period, and that this particular person gets super depressed. Is this normal, and what can you do about it? And I hear this complaint a lot. There's a difference between chronic depression and just some depressive symptoms that occur premenstrually, or typically the week or 2 before your period. And there is a much more severe form of PMS called PMDD, or premenstrual dysphoric disorder, where the symptoms can really be numerous and overwhelming and debilitating. So what can you do about some mild depressive symptoms before your period? Number 1, be prepared. Keep a calendar so that you know when your symptoms are going to come about. With all the amazing phone apps out there now, there's really no excuse not to know when your period is going to come if you're typically regular. So a day or 2 or 3 before your period, you can increase your exercise, which does tend to increase these endorphins, or wonderful feel-good chemicals in your brain, to really help with some feelings of well-being before your period. Watch the diet. No matter how difficult it might be, you do need to sometimes not give in to your cravings and keep a healthful diet before your period. And after a couple of months, you'll notice that you feel so much better that you really will have a good feedback to not do that and crave and overload on Ben & Jerry's each time you get your period. Certainly, if you find that your symptoms are either lasting all month or so bad that they're interfering with your day-to-day life, this needs to be addressed by your healthcare provider or a mental health professional, because it may not just be premenstrual syndrome, it may really be a sign of a more chronic depression and should be treated differently. I should make mention that birth control pills for some women will help with mood changes, and often equilibrating the hormone levels through the month with the pill can help with PMS or PMDD. In addition, there is an antidepressant that we often will use for just a portion of the month for people who really suffer with PMS and PMDD symptoms, where a pill is taken for up to a week or 2 of the menstrual cycle before the period to help with symptoms. And this we find to be quite helpful as well. So I hope that helps. Another question, can antibiotics affect your menstrual cycle? I think antibiotics affect your system in general. So if you're on a very strong, lengthy dose of antibiotics, and this is stressing your system, your cycle may be altered a little bit. I also like to keep in mind that if you're using birth control pills for contraception and also taking an antibiotic, your period could be off a little, and you may be a little bit more prone to pregnancy, and a condom is recommended. So I think that's important to keep in mind. This is a great question, and I'll go into this in a little bit of detail. What can be wrong if you don't get your period at all? So, of course, the first thing we're going to think about, and I've said this ad nauseum, is pregnancy. So we always check for pregnancy first. Number two, we pick up a lot of thyroid disorders in people who don't get their period or miss it for a while. So usually simple blood testing and an exam, a physical exam, can help to rule this out. And that's treated in a completely different way than just treating your period. Third is this polycystic ovarian syndrome, which again is a hormonal imbalance that often causes missed periods or lack of period altogether. Many times it comes along with other symptoms like hair growth on the face or typical male places. That also can come along with acne, weight gain or difficulty maintaining or losing weight, and infertility. So this is something we really want to pick up and not let go. Women with polycystic ovaries can also be at a higher chance for diabetes in their adult lives. So we really do want to diagnose this. So we do ultrasound imaging to look at the pelvic organs, and also hormonal blood testing and a physical exam to diagnose this, and typically treat with birth control pills or other medication, and diet and exercise. Other things that can be wrong if you're not getting your period would include other hormonal abnormalities that are a little bit more rare, but a gynecologist or an endocrinologist, which is a hormone-specific doctor, can really help to rule these things out. Certain medications can cause your period to disappear. And believe it or not, stress is a big one. So stress can cause a lack of period. Again, we often see this in young women who are going off to live alone for the first time, maybe going off to college, or who have a grief in their family or something along that line. And lastly, I never like to forget eating disorders such as anorexia and bulimia, or excessive exercise, which when taken to extremes really can cause the body to shut down in terms of the female hormones, and a lack of period as a result of that. So these are important things to look for. Other questions I'm getting are regarding products to use during the menstrual cycle for blood. And of course, you know, your typical products would include sanitary pads. They come in various sizes depending on and absorbencies. So depending on the nature of your flow, you can choose what's right for you. Many women do get irritated from fragrant or dyed pads, so that's something important to keep in mind when you're choosing your product. Tampons come in all kinds of varieties, shapes, sizes, and the like, and some women are very comfortable using tampons, of course, so I think that's perfectly fine. It's good to keep in mind that tampons shouldn't be left in for more than 8 hours ever, that the smallest sized tampon, which is good for your amount of flow, should be used, and feel free to change them frequently. Fragrant tampons for some women who are sensitive can cause some irritation. For women who want to use the menstrual cups that we spoke of, this is a good option. It does require you to feel very comfortable with your body and examining yourself so that you can insert it and remove it and feel comfortable with that. And hygiene is very important with this. But as far as women who don't have access to these things, I would advise just using something external. I've heard of people using just general rags and washing them out and placing them back when the flow needs to be caught again. And this is fine as long as you maintain best hygiene as you can. I would not insert things into the vagina, such as old socks or rags or anything that might have any chemical on it, because you could really put yourself at risk for infection. As far as leaving a tampon in overnight, since this seems to be a common question, this is fine. Again, I typically tell people to stick to that 8-hour rule or less. Some women just switch from tampons during the day to using pads at night so they don't have to worry about waking up in the middle of the night to change things, and that's a very reasonable alternative. There are some phone apps to watch your period and cycle. You know, none of them are coming to my mind offhand, but I would certainly just go on the App Store and look up period apps, and there are many of them, and you'll see what works for you. Otherwise, as I explained before, your cycle typically is measured as day 1 of your period until day 1 of your next period. So in general, if that's a 28-day time period, you really could just put a reminder on your phone or in a written calendar or diary that this is when your period is going to be due. And I do recommend people keep track of their periods. Number one, if they're sexually active, so they can either prepare for pregnancy or prevent pregnancy. But number two, just so that you get some education and knowledge about your cycle, which will be very valuable. I'm getting a question about an ovarian cyst and my period cramps, and that they are worse than ever. Is there anything that can be done about this? So this is a very good question, but I certainly would advise that this young lady see her healthcare provider. Ovarian cysts tend to form in some women, and women do get a small, tiny follicle, which is a very small cyst just full of fluid each month when you release an egg. And for some women, this is painful, and other women, they don't really notice it. But from time to time, you can get a much larger fluid collection in the ovary called an ovarian cyst, and this can cause pain, discomfort, bloating, and actually can twist and be a little bit of an emergency, or rupture and bring somebody to the emergency room. So for somebody who gets multiple ovarian cysts, and they've been checked by their healthcare provider and had an exam and perhaps an ultrasound and make sure that they're not pregnant, many times I'll advise the birth control pill as a way to prevent ovarian cysts. We do know that the pill suppresses ovulation, and that that's its usual way of function in terms of prevention of pregnancy. And this can also suppress ovarian cysts. So I have found this to be very helpful. In the meanwhile, if you find that you get a painful ovulation each month, or very, very painful periods each month, it's worth getting checked out to make sure you don't have that condition we spoke about before called endometriosis, which can be quite painful and also seems to be well controlled with the pill, pain medication, lifestyle changes, and in some cases, surgical intervention. Another question I'm getting is, what should the color of your menstrual blood look like, and what is healthy? Oh, so I get this question all the time, and I think part of this has to just do with the heaviness of the flow and the length of the flow. But in general, period blood can vary in color from kind of a rusty, dark brown type of color to even a bright red, more active color. And some of this is just basically showing us how active the bleeding is. So bright red blood is typically happening right then and there. And darker rust color blood is a little bit older, maybe sitting in the vagina for a little bit of time and taking its time to come out. And that's why it changes color a little bit. If you're having blood that has pus in it, or it's dark black, or it's a big, huge change for you in any way, this is reasonable to bring up to your healthcare provider and make sure that nothing else is going on, such as an infection or something along that line. The color of the blood and the amount of blood may also change throughout the, let's say, general week of your menses, so you'll get accustomed to what your typical cycle is. I'm getting a question about, are headaches and migraines linked to periods? I always get them. So for some women, migraine headaches and just general headaches are linked to the cycle. And some women also just find that they get headaches just randomly and they're not linked to the cycle at all. Usually, if you can predict during the cycle when you're going to get your headache, you can do, again, that anticipation of your pain, and instead of waiting until your headache comes on, you maybe take what typically works for your headache, whether it's Tylenol or Advil or Motrin or Excedrin, the night before, and hopefully get rid of the headache before it ever starts. And this is if it's a regular occurrence. Dietary factors sometimes influence headaches as well. So elimination, in some cases, of red wine, grapes, aged cheeses, these things can sometimes help to forgive a headache. And frankly, caffeine sometimes can help some of these headaches. In rare cases, and maybe not so rare cases, I'll often use birth control pills in a continuous fashion. In other words, with avoidance of getting the period other than maybe every 3 months, in an effort to prevent that monthly migraine headache, because these can be debilitating. And I always like to just throw out there that if headaches are waking you up in the middle of the night or so severe, this is not necessarily related to your cycle and really should be checked out by your primary care physician or even a neurologist in some cases, because we certainly don't want to miss something more serious. A question comes in again about medication that I would recommend for period pain. And you know, we usually do best with some of what are called the non-steroidal, over-the-counter anti-inflammatory medications. Advil, Motrin, Aleve is a good one, Midol, Pamprin. These are over-the-counter medications that are very helpful for pain that's related to your period. And they're safe when taken as directed, usually with food, and they tend to be helpful, especially if taken before your pain gets severe. So those are mainstay medications for period pain. Some women do not get enough relief from this and have to rely on stronger medications, including narcotics, which we really do not like to prescribe unless we have to, because they can impair certain functions for you, especially driving, and they can be addictive. And then lastly, the birth control pill or the hormonal IUD that I mentioned before can be very helpful in appropriate women for menstrual pain. Lastly, exercise, very helpful, and a heating pad, also helpful. So I would say that these are your mainstay treatments for menstrual pain. I'm reading a question about, I don't get cramps, but I get back pain. Is that PMS related? Well, you know, a good way to be sure that it's menstrually related is to put your back pain on the calendar along with your period. And if you see that every month you're getting back pain at the exact same time each month of your cycle, and then your period comes on, you can pretty much assume that this is your PMS symptom or one of them. The good news is the heating pad and the medications that I mentioned in the past couple of minutes are very helpful for back pain as well. If your back pain is persistent or not related to your cycle, it might be something else. And again, I would encourage you to see your doctor for that. Another question comes in, what will happen to my period when I stop the birth control pill? And you know, this is a great question because this is a common question and I hear it all the time. The truth of the matter is your period will typically go back to what it was before you ever started the pill. So if you had normal, monthly, not such bad periods prior to starting birth control pills, you most likely will go back to that after you come off the pill. But keep in mind, a lot of women use birth control pills for reasons other than birth control. Pain, irregular cycles, hormonal imbalance. And if you go on the pill for these reasons, and then you come off the pill for whatever reason, your period will likely go back to what it was beforehand. This ties in with something very important that I really like to bring up to my patients, and that's fertility. Women are always worried that their fertility is going to be affected in a negative way by birth control pills. And this is just simply not the case. The pill itself does not alter fertility, but here are two big things that do. Age. So if you've taken the pill from age 15 to 40, when you come off the pill, you're already having less fertility because of age rather than having been on the pill for all those years. So that's important. Number two, why did you go on the pill in the first place? If it was due to irregular periods or hormonal imbalance or even endometriosis-related pain, and then you come off the pill, your period will likely go back to what it was prior to, and those initiating problems are still present and in and of themselves may affect your fertility. So that's just an important aside that I like to make. I'm getting a question about breastfeeding and haven't had your period since you've given birth. When will it start again? I think we addressed this before, but just to reassure you, many women who are breastfeeding won't get their period for up to 7 or 8 months or even longer, especially if they're really breastfeeding frequently. This is not an issue. However, you do need to use some sort of contraception if you're having sex, because you still are able to get pregnant if you ovulate even just one time during this time frame. So keep that in mind. If you're not getting your period and you're not using protection, you need to check a pregnancy test and make sure that's not the issue. Otherwise, no problem with not getting your period while nursing. I'm getting a question about I bleed at other times other than my period. What could this mean? And again, we spoke about this briefly, but I think that, we check for pregnancy, we check for hormonal imbalances, including thyroid trouble, including medication history, including some sort of a structural problem that might be causing irregular bleeding, such as a polyp on the inside of the vagina, cervix, or uterus, or a fibroid or an ovarian cyst, which all can be signals or could be causative of some irregular bleeding. So if it's persistent, this is definitely something to bring to your healthcare provider for attention. I'm getting a question that your period is starting to get irregular and I'm middle-aged. Am I starting menopause? Oh boy, this is loaded. So, I think I like to differentiate between the term perimenopause, which is the 10 or so years before you actually are going to stop menstruating, where your hormones may be a little bit erratic and you may be ovulating irregularly. So your period absolutely can be a bit irregular at this time. You may skip some periods, you may have a heavier period or a shorter cycle. In general, this is something that you want to bring up with your healthcare provider, especially if it happens more than 1 or 2 months in a row, just to rule out any other problem, such as a structural problem that we spoke about, a hormonal imbalance, or something scarier that might be going on. But yes, it's very possible that you might be approaching that menopausal time, and that's why the period has become irregular. The average age of losing your period is about 52. So the several years leading up to that, you may notice some irregular cycles. As an aside, if you're having symptoms going along with your irregular periods and you're middle-aged, if you will, such as hot flashes or sweats at night or some mood volatility or difficulty sleeping, this also goes along with that whole perimenopausal time period. And there is hope because there is treatment for this if needed. I'm getting a question about recommendation regarding iron supplementation during your period. If you have very heavy periods or you've had a blood count that suggests you are anemic or have low blood, this is definitely a reason to beef up the iron both in your diet and possibly as a supplement. So dietary forms of iron would include red meat, green leafy vegetables, raisins. These are good forms of iron. Many women do not get enough iron in their diet and do lose each month. So the iron supplementations from over the counter are very helpful for this. Keep in mind, iron can be constipating. So you may want to drink a lot of water with iron and also consider a stool softener or more fiber in your diet. If your blood count is particularly low, you really should visit your healthcare provider and just make sure that you're losing blood only from your period and not from somewhere else. And you may want to initiate some sort of treatment to prevent such a heavy menstrual flow if that's determined to be the cause of your anemia. Okay. Another question that I'm getting is about, I read that tampons and pads can contain chemicals that are not good for your health. What is my take on that? So, I'm getting asked this more and more lately. I think I have more of an issue with some of the fragrances and dyes that might be in some of the menstrual products out there. And again, these are likely not horribly dangerous, but are, for some women, causative agents for irritation or reaction. So a lot of this depends on how sensitive your skin is and whether you're having a reaction to them. There are lots of new products out that are considered organic, if you will, which are free of any chemicals, etc. And certainly there's no harm in initiating those things if you want to be really pure about avoiding chemicals in the body. So I think that's the short answer to that question. One or two last questions that I've gotten. I feel uncomfortable using a pad when running cross country, but I'm afraid of a tampon falling out. What should I do? A lot of athletes have issues with their periods, especially if they're really intense athletes. So you can use a small tampon or a tampon that's appropriate for your flow during athletic events. It really would be pretty unusual for it to fall out unless you have a very voluminous vagina. For example, if you've delivered several over 10-pound children, to state that. But in general, for really intense athletes who want to avoid their periods so they don't have to use any tampons during their events, I usually recommend one of the continuous birth control pills in order to avoid their periods altogether, or one of the hormone releasing IUDs that might be helpful to cut down on the flow. But of course, you have to be the appropriate candidate for these products. And I think that pretty much covers most of the questions. So I think we'll end it there. And I would like to leave a lasting message that the period should be a sign of health, not a taboo. It is okay to discuss your period, not only with your healthcare provider, of course, but with a trusted adult, whether that's a parent or a friend or a sibling. And we want to know what's going on in your menstrual life. This is what gynecology is all about, so it shouldn't be something that's a secret. I think it's more a sign of fertility and health and femininity. So I would prefer that we all embrace and educate ourselves. It would be really great if you all could get involved in the campaign that is bringing awareness to the menstrual flow. And there is a website called letsfaceitperiod.org. You can go on there and learn more and make a donation if you like. There's also a big campaign with red lipstick, and so we will. I will take care of this on social media after this event. But please share in this event with us, and let's bring some more awareness and positivity to the field of menstrual health. Okay, thank you for listening.